Welcome to the Real Food Mental Health Podcast, where we explore the powerful connection between mental and physical health. My name is Cody Cox, a holistic nutritional psychotherapist, and I'm here to guide you on a journey to true wellness, mind, body, and spirit. If you're tired of quick fixes and want real solutions that address the root cause, you're in the right place. Let's get started on your path to lasting wellness. And we're back with another episode that is part of the series of an orientation to therapy. I contemplated making these episodes bonus episodes, but as I started recording, I realized that some of them are starting to get a little bit long. So they are full episodes, and we are going to postpone some of the guest episodes that I have recorded until a few weeks from now. So hopefully that's okay if you are a loyal subscriber. But with the internet and social media especially, have you noticed in the last couple of decades that a lot of people seem to think that they know what they're talking about when it comes to psychology? Well, we call that pop psychology or popular psychology, where, for example, if a person is just difficult to deal with, people are quick to call that person narcissistic or borderline personality or some other clinical term that isn't actually necessarily accurate for that person. Another one I hear a lot is gaslighting, and gaslighting technically isn't a clinical term. It's not an official diagnosis by any means, but it is often misused when a person feels like they're being controlled or manipulated. Well, that's actually not the definition of gaslighting. So popular psychology is unfortunately, I think, causing a lot of problems in society, as especially younger generations are throwing labels around, blaming each other, saying, well, you're narcissistic, it's all your fault. But as you think about how we keep playing the blame game, what does that do to our relationships? It actually tears them down. It does not inspire the other person to change and to get better, even if they do need to change and get better. In fact, in most cases, it's actually us who needs to change. So pop psychology is causing a lot of confusion when it comes to proper clinical diagnoses and also even the symptoms that are associated with proper clinical diagnoses. And I still see it a lot on social media, on YouTube, and sadly, I'm starting to see it and hear it from authority figures like politicians, from news reporters, both video news and like newspaper news or otherwise text. So this episode is all about proper clinical diagnoses, just to kind of straighten the record a little bit and hopefully clear up some confusion. There's a lot of things to cover, but I'm probably just going to cover what I think are the most common ones. And if you're listening on Spotify, feel free to leave a comment if you have some other ideas, or otherwise send me a message in some other way. I'd love to get some feedback on these episodes, or even some ideas for future episodes if you have any. So I mentioned in the last episode on finding the right therapist, when I was talking about psychologists can do what's called psychometric testing. Now, I'm not saying other therapists can't do it, but typically psychologists are kind of the default to doing that, and they charge a whole lot of money for that. So quite often, if a person isn't very familiar with the mental health professions and they feel like maybe their teenage daughter has ADHD or something and they want to get an official diagnosis, they tend to default straight to that psychometric form of getting that diagnosis, but you don't have to do that. It's very expensive. Sometimes it's necessary if you're looking for some kind of special school program, or sometimes even a particular medication. You might need that comprehensive psychiatric evaluation from a psychologist, but that's not usually necessary. So quite often people will get a medication from a general physician just from a casual diagnosis from that physician. And so I would definitely think twice about that if that's your inclination. If you've got a child who needs to be diagnosed, or you think they need to be diagnosed because you just want some kind of explanation for why they're struggling with life, or if you're thinking about it for yourself, you can get diagnosed from a therapist of any kind, as long as they're a licensed therapist. I mean, technically there's hypnotherapy and massage therapy, but as long as they're a licensed mental health therapist, you can get an official diagnosis from them. But then at the same time, what purpose does a diagnosis actually serve? I think when it comes to mental health or mental illness particularly, it doesn't really serve that much of a purpose to have that label. In many cases, I will not tell people what their diagnosis is. I do, as a best practice, I do diagnose every single person that I see, especially if I'm billing insurance, because insurance requires that as proof of medical necessity. But I don't tell people what their diagnosis is because I've found that it ends up being a self-fulfilling prophecy, particularly with something like ADHD or depression, sometimes even anxiety. Quite often, if it doesn't exacerbate a person's symptoms, knowing what their label is, they start using that as an excuse not to live their life and not to get better. So it actually can cause more harm than good to have such a label. When I was studying for my undergraduate degree, I studied sociology, and so we studied a lot of, we called it contemporary sociological theory. That was the name of the class that I took that was all about sociological theories. And one of those theories that has always stuck out in my mind was labeling theory. In fact, we talked about this in my criminology class too. But labeling theory is essentially the phenomenon that if you were to label somebody, even if they didn't really show signs of actually deserving that label. So for example, if you called somebody a criminal, even if they didn't really break the law, typically, just giving them that label, and especially if they're aware of that label, they will subconsciously try to accommodate that label. So they might actually start engaging in not necessarily like hardcore criminal behavior, but at least social deviant behavior. They might start subconsciously feeling like people don't trust them. And so if people don't trust them, then they're going to start doing some things that are a little bit out of character for them that they wouldn't otherwise do without that label. So I've always found that super fascinating, and I definitely apply that as a mental health therapist now when it comes to diagnosing. And so that's another reason that I don't tell people their diagnosis. On a rare occasion, I will if I feel like it's really necessary. So typically, I will only share a diagnosis if I'm writing a letter for an emotional support animal or a service animal, or if I'm sharing a super bill to be submitted to insurance for reimbursement, because that's just a necessary thing. And so I have to put that on those documents just as a legal requirement, or in insurance cases, I'm not sure that's exactly legal, but it is a requirement for them to actually reimburse the services that we are submitting a claim for. Now, some of the most common diagnoses are major depressive disorder, or what used to be called dysthymia, which is now called persistent depressive disorder. So that's basically major depressive disorder, but for longer term. Generalized anxiety disorder is another one. Attention deficit hyperactivity disorder, which I've always thought that was strange. I think it was around 2013 where they combined ADD and ADHD into one diagnosis. So it actually wasn't that long ago that we, for some reason, dropped the ADD diagnosis from the official list of diagnoses that we can use. And so now if anybody has an attention deficit and they meet all the criteria, we just say that they have attention deficit hyperactivity disorder, but we specify whether it's an inattentive type or a hyperactivity type or both. And I've always just found that to be kind of confusing, because just having the H in that acronym at all, I think implies to people that they must have hyperactivity. So if it's somebody who has a hard time paying attention and they're not hyperactive, some people might think, I don't have ADHD because I'm not hyperactive. But then on the other hand, a lot of people, especially younger adults, are just saying ADHD left and right. Oh, I can't pay attention, therefore I am ADHD, or I have ADHD. And that's where the confusion comes in with pop psychology. Just because you can't pay attention does not mean that you have ADHD. It does not mean that any officially licensed healthcare provider would actually diagnose you with that label. That's just you using pop psychology to diagnose yourself, and most likely it's inaccurate. And going back to depression and anxiety, I see the same things with those where just because you're depressed does not mean that you have major depressive disorder, or that just because you are anxious does not mean that you have generalized anxiety disorder. Just because you're feeling emotions or symptoms does not mean that you even have a diagnosable condition. And so there's so much confusion with that. Now, with these three main diagnoses, I did mention persistent depressive disorder as well. That one's lesser known, so I'm not going to talk so much about that. But the three main ones, anxiety, depression, and ADHD, they actually all have a common symptom, and that is difficulty concentrating. So if you know somebody or you yourself, you have a hard time concentrating, don't just assume that you have ADHD. It could be depression or anxiety or even something else. It could be a number of things. And so don't jump to the conclusion that you have a specific label just because of one prominent symptom that you have. Another thing is distraction. I mean, distraction is not quite the same as difficulty concentrating. I think a lot more people are distracted in today's society, especially since, I want to say in the last 5 years, since 5G was switched on. It's really messing with our brains. But the internet, being sedentary, high stress, eating poor food, there are a lot of factors that go into it that make us very distracted. We're also very addicted to things. So it might be screens, it might be shopping, it might be actual substances that we're putting in our bodies. We're addicted, and being addicted can make you very distracted too. So there are a lot of things that can appear like ADHD, but it might not be ADHD. Unfortunately, like I mentioned earlier, there are an increasing number of authority figures who are actually licensed healthcare providers who are getting confused between pop psychology and actual psychology. And so quite often, especially medical doctors, will misdiagnose. Now, if you were listening to a previous episode, I do explain that diagnosing is mostly for billing purposes, especially when insurance is involved. And so I think doctors actually do this just as much as therapists do. They will just give an arbitrary diagnosis. We do our best to diagnose as accurately as possible, but in the grand scheme of things, if you think about it, a diagnosis really is just a man-made label. It's not perfect. So when you think about it that way, there really is no 100% accurate way of diagnosing anybody. So to go back to the ADHD example, if somebody has an attention deficit or if they're generally distracted, there might actually be some other label that would be better fitting than simply ADHD, even if a person meets most of the criteria to be diagnosed with ADHD. It's too hard to know because there are hundreds, maybe even of thousands of medical diagnoses that could be assigned to a single patient. So medical doctors will typically diagnose somebody with even multiple diagnoses when they prescribe a medication. And I don't know what the official statistics are right now, but I have noticed that ADHD medications are being handed out like candy lately. And I'm thinking it's because physicians, for one thing, they don't really have that much training in mental health. They're more about pharmaceuticals and surgeries. So they study anatomy and physiology and surgery basically in medical school, not so much about how the brain works. And so they will hand out these ADHD medications like candy because they have so many patients now coming to them saying, I can't pay attention, I can't focus at work, I can't focus in school. And so they write a prescription for Adderall or Ritalin or something similar. And the patient might actually do better in terms of symptoms using that medication, but it's really not properly addressing the root cause of the problem. It could be simple distraction rather than difficulty concentrating. But doctors, they don't really understand really what the difference is. So they just think, well, if a person can't pay attention, I'm just going to write this prescription because they have ADHD. And they're not really properly assessing. They're just going off of the prominent symptom rather than assessing for all of the symptoms that are required for such a diagnosis. Now, antidepressants and anti-anxiety medications are also handed out quite a lot, and I would say probably too much, where frankly a doctor just doesn't know what to do because, like I said, they don't have any training in mental health. So they don't know what to do when a patient comes to them and they're like, oh, I'm suicidal or I'm depressed. I have a hard time getting out of bed. I can't make it to work most of the time. I'm afraid I'm going to get fired from my job. I'm afraid of talking to people, doing the customer service that I'm supposed to do at my job because I'm so anxious. And so once again, doctors are looking at these prominent symptoms and just jumping straight to a diagnosis to justify the medication that they're prescribing so they can put that on the documents that they submit to insurance to get reimbursed for that service. Is medication sometimes necessary? I do think it is, but it is overprescribed. I think we jump to medication as a first resort in American society now, where in my opinion it really should be more of a last resort because it does cause a lot of imbalances in the body and in the brain that aren't easily corrected using diet and lifestyle after you've been on medication for a while, especially if you are currently still on medication. So as a nutritional psychotherapist, I often have people come to me who are still on medication and they want me to help them with diet and lifestyle for their mental health. And I have to tell almost everybody, you really have to get off this medication, but you have to work with your doctor to do it. So you're going to have to make extra appointments to work with your doctor to reduce your medication and eventually get off of it, because it's actually kind of covering up the symptoms that we're hoping to address using diet and lifestyle. And if I don't know all of the symptoms that you are dealing with, then I don't even know exactly what we're working toward because the medications cover up a lot. Now, in terms of diagnosis and medication, that's another really tricky thing. As a psychotherapist who can't prescribe medication, often I have people come to me, even if they're just coming for psychotherapy, they don't necessarily want nutritional help. I don't know really how to diagnose them. Like, I can do my best, but it's pretty much guaranteed that it's not going to be an accurate diagnosis because they're on a medication and I don't know what they're like without that medication. So how am I supposed to know what their symptoms actually are when the medication is covering some symptoms up and it might even be causing other symptoms that they wouldn't otherwise have? So that's another thing. So we take diagnosis with a grain of salt. It is mostly for billing purposes. It's a superficial label, but at the same time, you want to be careful not to fall in that trap of pop psychology where you're just casually throwing that label at people or casually labeling yourself because you think you know better based off of what was taught on social media or on the news or even from a healthcare provider who simply just doesn't know what they're talking about. But to continue with the theme of an orientation to therapy, if you were to go to a therapist and they diagnosed you and they told you your diagnosis, That actually could be a problem. So I just want you to pay attention to that labeling theory and just be mindful of that. So I'm not saying that the therapist is doing wrong because they are telling you your diagnosis, but if you're not being mindful of your thoughts around that diagnosis, it could become a self-fulfilling prophecy. So just pay attention to how you're feeling about the diagnosis. Make an effort not to use it as an excuse not to live your life or not to get better, because that's typically what happens when a person over-identifies with a label of any kind. Even if it's not a clinical diagnosis, maybe it's a political label or some other label, quite often that is what happens. It becomes part of their identity. But because it's so important to get an actual diagnosis from an actual provider who can diagnose, I thought about going over the official symptoms for the more common diagnoses, but I thought twice about that because I don't want you to self-diagnose. So I'm not going to go over the specific symptoms that are associated with depression, anxiety, ADHD, autism, narcissistic personality disorder. There are lists of symptoms that we are supposed to assess for that come from the DSM-5 or the ICD-10. These are just clinical acronyms that nobody cares about except therapists. I guess doctors might care too, but anyway, so there are official lists of symptoms that we're supposed to assess for when we make these diagnoses. And I would encourage you, if you suspect that you have a diagnosis, just go see a therapist and talk to them. Think twice about asking for a diagnosis, but focus more on addressing your overall concerns. So maybe it's the symptoms that you're having. You're like, oh, I'm too scared to give a presentation in school, and so sometimes I don't do it and I'm getting a bad grade. So like that would be more of a behavioral issue. So focus on the behavioral issues that your therapist can actually walk you through without telling you what your label actually is. Now, this has turned out to be a shorter episode because I decided not to go over the official symptoms for specific diagnoses, but I did want to close the episode by talking about what exactly is mental illness. Most people have this idea of, well, if I just am having a bad day, therefore I'm mentally ill. Maybe I'm just angry. Maybe I have poor relationships. Yeah, you might have a mental illness if those are some of your issues, but a mental illness can manifest in so many different ways. That's why we have so many different diagnoses that are all about mental health. So in general, though, if I were to, this is actually oversimplifying it, but if I were to simplify it and just kind of give you a blanket statement of what mental illness actually means, essentially what it is if you've got some cognitive issues, so that has to do with your thoughts. If you've got some difficulty concentrating, maybe it's something like brain fog, maybe it's memory issues, maybe you're feeling moody, maybe you're feeling really fearful all the time or anxious all the time. You've got these things going on that are actually getting in the way of your everyday life. I would say that's a clinical problem of some kind, which means you probably have some sort of mental illness. So that's what a mental illness is. It's not simply having a bad day. It's not simply having a disagreement with somebody. It doesn't mean that the person you're disagreeing with is mentally ill, but it's more of a chronic issue, something that goes on for weeks or months or years at a time. I hope you enjoyed today's episode. If you have any other ideas on pop psychology or official clinical diagnoses, make sure you leave a comment on Spotify or send me a message in some other way. I am using the Signal Messenger app, and you're free to send me a message on there as long as it's an appropriate message, of course. My username is cox.07, that's cox.07. If you haven't already, make sure you subscribe to this show so you can catch the end of this series on an orientation to therapy, in addition to future episodes with excellent guests. And if you're curious about what I do professionally, you can find me at beavercreekwellness.com or on Instagram at beavercreekwellness. Real Food Mental Health is intended for informational and entertainment purposes only. The information presented on this podcast is not intended to replace any medical advice, diagnosis, or treatment. While I am a healthcare provider, I am not your provider. Always seek the advice of an appropriate healthcare practitioner with any personal questions you may have regarding a medical condition. Never disregard professional medical advice or delay in seeking it because of something you have heard on this podcast. Reliance on information provided by this podcast is at your own risk.